Good afternoon, and welcome to the webinar for the Heartland RHEC of Region 7, Leveraging CLAS, the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare. Today's webinar will be presented by myself, Darcy Graves, and my colleague, Godfrey Jacobs. We're very excited to be speaking with you all today, and with that, I'll let Mr. Jacobs introduce himself.
Well, hello, everybody. It's a real pleasure to be with you today. Godfrey Jacobs here. I serve as the manager of the Health Determinants and Disparities Practice at SRA, and one of the things that we do through that practice is manage a contract for the Office of Minority Health called Think Cultural Health. It's a real pleasure to be with you, as I said, particularly as you get ready to begin the next round of registrations or enrollments for the ACA. I'll keep my introduction short, and Darcy, I'll pass it over to you for your introduction.
Thank you. I am also a member of the Health Determinants and Disparities Practice at SRA International. I have the pleasure of serving as the Senior Health Education and Policy Specialist. And between Godfrey and I, we worked on the National CLAS Standards for a number of years. And I'm particularly excited to be speaking with you all today because I identify as a Midwesterner at heart and spent the greater part of my life in Missouri and in the Kansas City region in particular. So I'm excited to be speaking to all of you. And with that, we'll move on to the next slide.
And I'll start off by saying that I wanted to acknowledge, first of all, the other members of our team who have been very helpful and have worked very hard in the past 4 years to bring forth the new and improved, I think, National CLAS Standards, the enhanced CLAS Standards. And they're listed there on the first slide. And you can move on to the next one, in which we want to talk about the Office of Minority Health and its mission, which is to improve the health of racial and ethnic minority populations through the development of health policies and programs that will help eliminate health disparities. As you know, there is a significant body of research that documents the persistent and widespread disparities experienced by many communities in our nation. The Secretary of Health and Human Services has in the past noted that minorities and low-income Americans are more likely to be sick and less likely to get the care they need. So the Office of Minority Health has several important cultural and linguistic competency initiatives to help address these disparities, including over a decade of work with the National CLAS Standards, going back to 1999 when the first set were promulgated. In the next slide, I'd like to describe a bit of what is CLAS. If we were in an auditorium, I'd ask for a show of hands as to how many people have heard of CLAS. And I hope that I would have seen a few hands go up. And hopefully, as the years go by, we'll see many more of these hands. But CLAS is an acronym for Culturally and Linguistically Appropriate Services. What do we mean by that? We define CLAS as services that are respectful of and responsive to, and you can keep, there are 3 slides here you should roll as I'm speaking, and you can go to the next one now, but respectful of and responsive to individual cultural health beliefs and practices, preferred languages, health literacy levels, and communication needs, and are employed, and you can go to the next slide, and are employed by all members of an organization. All members of an organization, regardless of size, at every point of contact. It's really important to get that point as we talk about class, because it really has to be most effective, something that is understood throughout the organization and to which the organization is committed. So it's important to note that every healthcare encounter is a cross-cultural interaction. You should consider not only your client's culture, and I think that, parenthetically, by the way, that this is really an important point as you get ready to register new participants in the ACA, that you should consider not only your client's culture, but also your culture and the culture of your organization. Because these different pieces have to work together in order to be effectively communicated to the clients that you'll be working with. So keep this in mind as you seek to respond effectively to the needs of those that you will be registering from diverse communities in your respective service areas. And we could flip to the next slide, which you see here we talk about every point of contact. And you see the different boxes there which describe the types of contact that we're speaking about. So we need to think about class, as I said, at every point of contact. Class and communication is important during the client-provider encounter, but there is much more to the health and healthcare continuum that includes how to structure outreach activities and services, establish trusting relationships between counselors and enrollees, target communications to increase effectiveness, and overcome language and literacy barriers. We also need to be aware of education and training related to class and communication, and providing easy-to-understand print and multimedia materials and signage as we partner with the community. So as you look at those boxes, think in terms of where do I fit? How do I more effectively get engaged with the clients that I am trying to reach? So in the next slide, we're talking now about the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare. You can move the slide ahead. There you go. And as you see here, these standards were originally published in the year 2000 and then republished in the year 2013. Sometimes I don't like to admit it, but I was there for both of these. And it's been a really very interesting process. The Office of Minority Health has developed a framework for operationalizing class, and it's called the National CLAS Standards, as you see by the heading here. The standards are an important tool for promoting and implementing culturally and linguistically appropriate services, and I think you will find that they're a very important tool for the work that you're doing as well as you seek to enroll as many people as possible in the ACA. The National CLAS Standards were first developed by the HHS Office of Minority Health in 2000, and in 2010, the Office of Minority Health launched an initiative to update the standards, which incorporated public comment, a literature review, and ongoing consultations with an advisory committee comprised of 36 experts representing a variety of disciplines and organizations. In April of last year, 2013, we were very excited to release the Enhanced National CLAS Standards, and we had an opportunity to do so at the White House itself. There are 15 standards, and I think the White House issue in terms of doing it at the White House was an indication of the importance that the administration, or HHS and the administration, placed on the standards. So, as I was about to say, there are 15 standards, each of which is an action step that guides professionals and organizations in their implementation of culturally and and linguistically appropriate services. Now I'm going to ask Darcy to walk us through some of the new things that came into our enhanced National CLAS Standards, and also to take us through the standards as well. Darcy.
Great. Thank you, Godfrey. As a quick aside, it's hard for me to believe, but this Venn diagram that you see on this slide is a model of discussing cultural and linguistic competency that I developed when I was a faculty member at the University of Missouri Kansas City School of Medicine. So I really feel like I've come full circle, as I know members of the staff and faculty at UMKC are also listening on this call. So as Godfrey said, between 2010 and 2013, the National CLAS Standards underwent an enhancement initiative. This was to make sure that we could take, that we revisited the National CLAS Standards, that we made sure that they were as valid and reliable and as useful today as they were when they were first promulgated back in 2000. One of the things that changes was a broadened or expanded definition of culture. In the standards, culture encompasses race, ethnicity, and linguistics, as well as geographic, religious, spiritual, biological, and sociological characteristics. Culture is defined as the integrated pattern of thoughts, communications, actions, customs, beliefs, values, and institutions associated wholly or partially with racial, ethnic, or linguistic groups, as well as with religious, spiritual, biological, geographical, or sociological characteristics. Culture is dynamic in nature, and individuals may identify with multiple cultures over the course of their lifetime. And this definition attempts to reflect the complex nature of culture as well as the various areas in which culture can be defined and studied across previous other disciplines. If you look to the next slide, we have also a definition of health. Now, there was an implicit definition of health in the original iteration of the National CLAS Standards. In this iteration, we wanted to be explicit in our definition, and therefore, when we talk about health and when we talk about well-being, we're referring to physical, mental, social, and spiritual well-being, because all of those pieces, influence how one's health is perceived and received. Moving on to the next slide, we also made sure that the standards were referenced in both health and healthcare organizations. Therefore, medicine, behavioral health, mental health, public health, social work, community health centers, emergency health centers, and so many more are included and reflected and can use this tool that is the National CLAS Standards. And then on the next slide, we can see what is the purpose or what is the intention of the National CLAS Standards. And it's to advance health equity, improve quality of services, and help eliminate the health and healthcare disparities. Now, with that said, now we're going to talk about the National CLAS Standards themselves. And when we look at the next slide, you can see how the National CLAS Standards are organized. And part of the reasons, there's a myriad of reasons as to why they're structured like this. But again, to underscore what Godfrey said, the National CLAS Standards are really to serve as a tool for you and your organization to operationalize the concepts of cultural and linguistic competency. Because it's great when we all sit down and say, let's make this culture more culturally appropriate, or let's make this more accessible to our linguistic community, our community members who have English as a second language. But how do I go about doing that? How do I do that at every point of contact? How do I make sure that everything we do is culturally and linguistically appropriate? So we hope that this tool can be used not only by the individuals on the line who are working to enroll individuals with the ACA starting next month, but also other organizations in the Heartland region who are working to connect with, to provide services to and to improve the well-being of all of our community members. So the National CLAS Standards are comprised of 15 standards that inform and facilitate the implementation of culturally and linguistically appropriate services. As you can see, there is a principal standard, or standard number 1, that serves as an overarching goal for all of the other standards. The remainder of the standards are structured into 3 overall themes: governance, leadership, and workforce, communication and language assistance, and engagement, continuous improvement, and accountability. Now, in the next slide, we look at the principal standard itself. And the principal standard frames the essential goal of all the standards. Therefore, conceptually, if all of the other 14 standards are adopted, implemented, and maintained, then the principal standard will in itself be achieved. What do we mean by providing effective, equitable, understandable, and respectful quality care and services? Well, that means it helps to create a safe and welcoming environment at every point of contact that fosters an appreciation of diversity of individuals and provides patient and family-centered care, and ultimately can improve the perceived access to care. It allows an organization to meet the communication needs so that individuals understand the health care and services that they are receiving, can participate effectively in their own care, and make informed decisions. And then finally, by meeting this standard, you will be helping your organization eliminate discrimination and healthcare disparities. The first theme of the National CLAS Standards is governance, leadership, and workforce, which emphasizes the implementing of CLAS is the responsibility of the entire system. Implementing CLAS really requires the investment, support, and training of all individuals within an organization. The impetus for implementing CLAS can and often does come from the bottom up. However, an organization's leadership shapes the culture of the organization through its priorities, expectations, and the behavior that it models. Therefore, the impetus for implementing CLAS should also come from the top down. The standards teach us that implementing CLAS at every point of contact is critical to improve quality of care and avoid this type of situation. The standards within Theme 1 include the following. Standard 2 underscores that CLAS must permeate every aspect of the organization from the top down and the bottom up. And we know that leadership in large part determines whether the organization's culture will embody quality, safety, and CLAS. Standard 2 can help organizations provide adequate resources to support and sustain CLAS initiatives, as well as to model an appreciation and respect for diversity, inclusiveness, and all beliefs and practices. Standard 3 has to do with recruiting, promoting, and supporting a diverse governance, leadership, and workforce. It will help organizations to create an environment in which culturally diverse individuals feel welcomed and valued, as well as infuse multicultural perspectives into planning, design, and implementation of CLAS. Finally, Standard 4 has to do with educating and training governance and leadership and workforce, which will help organizations prepare and support a workforce that works well with diverse populations, as well as assessing the progress of staff in developing cultural, linguistic, and health literacy competency. In Theme 2, we address communication and language assistance. And one of the areas I know that Godfrey referenced earlier in speaking with individuals in Region 7 was overcoming language and literacy barriers. And we really think that these 4 standards in particular can assist with that. Communication and language assistance provides guidance on how to effectively meet patients' communication needs, including sign language, braille, oral interpretation, and written translation. In addition, the standards in this theme will help organizations comply with federal requirements, such as Title VI of the Civil Rights Act of 1964, the Americans with Disabilities Act of 1990, and other relevant federal, state, and local requirements to which you may need to adhere. To dive deeper into Theme 2, Standard 5 has to do with offering communication and language assistance, which helps an organization make sure that individuals with limited English proficiency and or other communication needs have equitable access to health services. It also allows organizations to improve patient safety and reduce medical errors related to miscommunication. Standard 6 has to do with informing individuals of the availability of language assistance services, which will help organizations inform individuals with limited English proficiency in their preferred language that language services are readily available at no cost to them. And it will also facilitate access to language services. On the next slide, we'll see the other two standards in this theme, Standard 7 and Standard 8. Standard 7 has to do with ensuring the competence of individuals providing language assistance, which will help organizations provide accurate and effective communication between individuals and providers, as well as empowering individuals to negotiate and advocate for important services by effective and accurate communication with health and healthcare staff. Standard 8 has to do with providing easy-to-understand materials and signage. It will help organizations make sure that the readers of other languages and individuals with various health literacy levels are able to understand and access care and services, as well as enabling all individuals to make informed decisions regarding their health and their care and service options. The next and final theme of the National CLAS Standards is theme 3, which has to do with engagement, continuous improvement, and accountability. This theme underscores the importance of establishing both individual and organizational responsibility for implementing CLAS. Effective delivery of CLAS demands actions across an organization. This theme focuses on the supports necessary for adoption, implementation, and maintenance of culturally and linguistically appropriate policies and services, regardless of one's role within an organization or practice. All individuals are accountable for upholding the values and the intent of the National CLAS Standards. So that means not only at the C-suite, but as well as individuals who are working in the reception desk or as parking lot attendants or the like. Everyone has a role to play when it comes to implementing and living the National CLAS Standards. So as we move to the next slide, we dive deeper into theme 3, and Standard 9 has to do with infusing CLAS throughout the organization's planning and operations. So this will help organizations make CLAS central to the organization's service, administrative, and supportive functions, as well as link CLAS to other organizational activities, including policy, procedures, and decision-making related to outcomes accountability. So really this comes down to making sure that all of the plans that your organization is developing are in and of themselves culturally and linguistically appropriate. Having, a plan for CLAS, but also making sure that all of your plans have CLAS within them. So this isn't an add-on, but a way of modifying what it is that you currently do. Standard 10 has to do with conducting organizational assessments. And this will help an organization assess the performance and monitor progress in implementing the National CLAS Standards, obtaining information about the organization, the people it serves, which can be used to tailor and improve services. As we move on to Standard 11, this has to do with collecting and maintaining demographic data, which will help organizations accurately identify population groups within a service area and monitor individual needs, access, utilization, quality of care, and outcome patterns. And this will also help with organizations when you're trying to do effective outreach. You need to know who you're doing outreach to. And one of the following standards, when you combine this reliable demographic data with working with those individuals in the community, you can create the materials, you can create the messages to build trust and rapport and to craft messages that will truly resonate with the audience that you're attempting to work with. Standard 12 has to do with conducting assessments of community health assets and needs, which helps an organization determine the service assets and needs of the populations in the service area, or a needs assessment. Identify all of the services available and not available to the population in the service areas, which can be conceived of as a resource inventory and a gaps analysis. And then finally, determine what services to provide and how to implement them based on the results of your community assessment. The last three standards in Theme 3 and of the standards themselves are 13, 14, and 15. Standard 13 has to do with partnering with the community, and this is the one I was just referencing moments ago. This will help organizations provide responsive and appropriate service delivery to a community, and it will empower members of the community in becoming active participants in the health and healthcare process by keying in to key decision makers, by working with community-based organizations that the community trusts and works with, then you too, then your organization can improve things as well and balance that connection. Standard 14 has to do with creating conflict and grievance resolution processes that are culturally and linguistically appropriate themselves. And this will help organizations facilitate open and transparent two-way communication and feedback mechanisms between individuals and organizations. This will allow us to anticipate, identify, and respond to cross-cultural needs. Standard 15 has to do with communicating the organization's progress. This will help organizations convey information to intended audiences about efforts and accomplishments in meeting the National CLAS Standards, as well as building and sustaining communication on class priorities and foster trust between the community and the service setting. Now,
well, I know that, this is Godfrey again, I know that this is a lot to digest. And for those of you who have not been exposed to the class standards before, I know you're probably saying, wow, what's all this stuff? But there are ways for you to take it in smaller pieces, and I'll point that out in a minute, because all of these standards are available on our website, and we also have, as you will see later, a blueprint that will help to explain that even further. Therefore, I want to turn to the next issue of resources and to talk a little bit about where you can turn for these National CLAS Standards, the blueprint, and indeed more. I mentioned earlier about Think Cultural Health as the project that we implement for the Office of Minority Health, and that sponsored website, I think it's showing up on this slide, or we'll show it a little. Yes, it is showing up at the top of this slide. Here you will find lots of what I think are good things from which you can choose. We have a suite of e-learning programs which have free online continuing education. We have the Class Clearinghouse, which is a keyword searchable database of resources. We have a thing we call Join the Click, which provides you with a newsletter, calendar, and other educational materials. And of course, we have the National CLAS Standards and the blueprint. So this cultural health site is a valuable resource for you as you continue to learn more and more about and implement the National CLAS Standards. We've become a trusted site for health professionals to turn to for information and education related to class and health equity. So, in addition to housing the CLAS Standards and the blueprint, and the blueprint, by the way, describes each of the standards and its purpose, along with some of the strategies and resources for implementing each standard. It was interesting as I was listening to Darcy go through the standards, I was reflecting on how those standards were condensed from the thousands of hours of discussion that we had with our National Project Advisory Committee, so that within those standards there's some really well thought through things that obviously, we could spend many hours on each one. but that's why we did the blueprint, so that you could have a chance to yourself examine the issues inherent within each of these standards and find ways that it applies to your daily activities. So feel free I hope you will visit all of the resources that are listed in the blueprint, and they're available, as I said before, through our clearinghouse, and readily available for you to absorb. In the next slide, I think we're depicting the blueprint itself. Yes, there it is, and it really is I think it'll give you a good navigation through these class standards, through these national class standards. And in there you'll find the case for class, the enhancements themselves, a standard by standard chapter on purpose, description, strategies, and resources. This blueprint was designed to provide individuals, agencies, and organizations of all kinds the guidance to implement the national class standards. So I really hope that you will have an opportunity to go to this website and download this free of charge and use it as you see fit. That actually ends the presentation. In the next slide, what I want to say is that we really would love to hear from you, because it's people in the field that help us to better interpret the needs that arise from day to day as the class standards get implemented. There is a very active implementation activity or initiative going on with OMH and ourselves working together as a team in various parts of the country and in various kinds of activities to try and get these standards better understood and hopefully more widely implemented. So let us hear about how class is going at your home organization and in your area. And as I said before, we are interested in the documents you create, the information you share, and how you're opening doors to the world. As I said at the beginning, I would have asked for a show of hands. Hopefully some of you are in fact implementing these standards and are familiar with them. And if you're not, I really want to urge you to begin the journey, because remember that cultural competence is not a destination, but a journey. And each day we learn something a little more, and we're able to work with our clients a little better, to understand their situations better, to interpret the issues that they face better. And I think that using that kind of approach will actually increase the number of people that you'll be able to enroll in the ACA. So with that, we'll close unless Darcy has anything else you want to add.
No, I think we wanted to make sure that we provided ample time for questions and answers. I know we have the operator on standby who's able to unmute your phone line if you choose to ask your question that way, or you are able to submit questions in the chat box feature.
Okay. At this time, if anyone would like to ask a question, please press star and then the number 1 on your telephone keypad. Press star and the number 1 on your telephone keypad if you'd like to ask a question. And there are no questions in queue at this time.
Okay. I think.
Do we have any on the?
Can I order multiple? Here's a question from the chat box. Can I order multiple copies of the blueprint? I'd like to distribute to partners. Well, as Godfrey intimated, if you go to the Think Cultural Health website and complete a brief registration form, you can download the entirety of the blueprint or specific standards, depending on what your organization is most interested in. And obviously, then that can be, you can print multiple copies for distribution amongst your organization. So hopefully that can help with that individual's questions. But we have the web-based version for those who are interested in bookmarking, you know, on your computer for easy access that way, or you can print hard copies from the website and to facilitate access for multiple individuals within your organization. We will be able to share a copy of the PowerPoint today. If you care to email us at advancingclass@thinkculturalhealth.hhs.gov, we'd be happy to provide you with a PDF version of this. And I just received a reminder. And a copy will also be emailed to you all. There is also an evaluation for this webinar. If you fill out the survey, please click on the lock that is to be posted in the chat box and submit your feedback regarding your experience on this webinar. The link will be available for approximately 10 minutes, and the link is up now. Yes, you will receive copies of the PowerPoint, and copies of the blueprint is available both in web and PDF form from the Think Cultural Health website. Do we have any additional questions?
We do have a question, Ms. Graves.
Okay.
We have Christopher Boyce. Your line is live.
This is Gerald Early at UMKC. And so my question for you is, what do we have available for us to benchmark how we're doing as we apply the standards?
You mean as you go from point to point? You mean is there a tool to help you benchmark this?
Yeah, or is there a best practice or an organization that demonstrates best practice? Or?
Well, there are several organizations that are implementing the CLAS standards now, and one of the things that we want to do, and are doing in fact, is beginning to have an evaluation protocol that will help us understand better how those different organizations are implementing the CLAS standards, and indeed the best practices that come out of that. So that will become available, and it'll be available for people like yourself to use in whatever fashion you choose to, either in terms of looking at how they did it or learning from the lessons they learned from implementation. So that's not too far away.
Okay, thank you.
Sure.
And that was our last question.
Okay.
Is there any more on this something?
No.
Okay. Well, it's been wonderful speaking to you.
If questions occur to you at a later time, please do not hesitate to email us at the Advancing Class email address. It certainly has been a pleasure speaking with you all today.
Ms. Graves, we do have another question from Herman Edwards. Your line is live.
Okay.
Go ahead, Mr. Edwards.
Mr. Edwards, your line is live. Okay, there's no one on there. I'll release that call.
Okay. We also received another comment or another question in the chat box about providing navigators and assisters practical tips for using these in their outreach efforts. I think the way, I think where I would recommend starting is one, figuring out who is exactly in your communities that you're trying to target, connecting with possible leaders in those areas, partnering with other organizations in your communities, whether that be school districts or churches, synagogues, and the like. and working with them to establish that trust, to establish that relationship, so that to make sure that your messages are being handled and received in the appropriate channels. Look for distribution channels that touch on a variety of communication needs and community needs. So whether that be quote-unquote minority-run newspapers or radio stations that are done in multiple languages, finding out how those communities receive their information. How do you find them, and how do they find you? And how do they know that you are a trustworthy organization? So really that making sure that you've established those rapports, making sure that the navigators and assisters have the appropriate training. And
I would add, understanding the needs of the communities that you're outreaching to. And it's really within the class standards, especially in the accountability standards, you'll find guides to help you establish what types of information that you need to collect, what types of information that you need to share, and what kind of communication you need to have with those in the community who you need to be outreaching to and with whom you need to be communicating. The more credibility that you can establish in terms of showing a sincere interest in the needs of the community, I think the better the services you can provide will be, and the more responsive the community will be to the services that you provide.
Yeah. So thank you very much for that question. We've received another question on whether it would be feasible to connect university research centers with OMH to ensure that CLAS is implemented in research, which often includes health measurement and health protocols.
Yes, indeed. That's exactly one of the things we want to establish, and it's part of our implementation initiative. Now, I'm not claiming that it has been established, but I am saying that we have every intention of pursuing that. And in fact, we are working with a couple of universities already that have shown interest in doing just that, not only with our class standards, but with some of the curricula that are also available on our website, specifically with the physician's curriculum and also the oral health curriculum. I know health academic centers are already working with us in terms of doing some implementation issues. So I'm rather excited about that possibility and the extent to which we would be able to get this into the curricula of these medical and dental and other healthcare organizational institutions. Go ahead.
And I would add to that a number of HHS organizations or agencies that fall under the umbrella of the Department of Health and Human Services, or HHS, are beginning to include CLAS in their request for proposals, in their granting applications, in their funding opportunities. So most of the time, or many of the times, that a federal grant application or a federal request for proposals is calling for inclusion of either the National CLAS Standards or for the representation or inclusion of culturally and linguistically appropriate services. The National CLAS Standards are an absolute viable tool to show how you're implementing CLAS or how you're meeting the requirements within those within that grant application, or within your reporting efforts on and for that grant.
And I think that's a growing trend. You're going to see more and more requirements to include or be not just committed, but actually implementing CLAS in the programs that are being applied for funding in the grant programs that the federal government funds, that HHS funds, more specifically.
Yes.
Well, look, I would be really, I don't know how we might be able to do this, but I really would be keenly interested in hearing from any of you as to how these tools are of assistance to you, to what extent if it's possible to gauge this, to what extent they've helped you sign up more people, or how many people perhaps they helped you in signing up. And I understand right now it would not be a scientific approach, but sometimes these ad hoc reports can be very useful as well.
Yes. Just so you all are aware, the PDF of these webinar slides has been shared in the chat box, so all you have to do is click on that PDF link, and you will be able to save it to your desktop and have a quick and easy reference on the National CLAS Standards. Do we have any other questions on the phone, or does anyone else want to submit a question via the chat box?
Just as a reminder, please press star and the number 1 on your telephone keypad if you would like to ask a question. Press star and the number 1 on your telephone keypad. And there are no questions in queue at this time.
Okay. Thank you very much.
Well, thanks everybody for participating today.
Yes.
And good luck in the months ahead.
Yes. Good luck with the enrollment or whatever your organization's mission is. We hope that you find the National CLAS Standards a rich and reliable tool that you can use to improve, regardless of your organization's mission, to improve the cultural and linguistically appropriateness of the care and services that you provide. Again, please do not forget to fill out your survey for this webinar. The link appears a couple of times in the webinar's chat box. The PDF of the slides is available for download in the chat box. And if you have any additional questions, please feel free to email either Godfrey or I at advancingclass@thinkculturalhealth.hhs.gov, or to reference any of the resources, including the National CLAS Standards that we talked about today during the presentation, please visit the website www.thinkculturalhealth.hhs.gov. Thank you again for spending this hour with us, and enjoy the remainder of your day. Thank you so much.
Goodbye, everybody.